Hello and welcome to Business Insider with Mario Toneguzzi on YYC Business. Joining me today is Danielle Smith, who is the author of a new report called Alberta's Key Challenges and Opportunities, which was for the School of Public Policy at the University of Calgary. Thanks for joining us today, Danielle.
My pleasure. Nice to talk to you, Mario.
Danielle, let me just start by asking you, in a general sense, what was the purpose of the report and why did you undertake this topic?
You know, there's a couple of reasons for it. I had a few people ask me once they read it, how long have you been working on this? And in some ways, I've been working on it for my entire career in public policy and media, because I drew together some of the ideas that I think we absolutely need if we're ever going to get back into balanced budget in Alberta. Took on the idea that the problem is in the business sector, that we're not diversified enough. I completely reject that. I think that the business sector is incredibly entrepreneurial and diversified. The real problem that we have is that our Alberta government, its source of resources, its source of revenues are not diversified. And so what they've done is that they've put themselves in a position where they're over-reliant on some of the most volatile streams of revenue, whether it's corporate income taxes or whether it's royalty revenue. So that when some calamity hits, like it did in 2008 or 2014, or now, they don't have the sustainable revenues to fund all the social programs that we care about so much. And so we need to find a different way to establish our baseline revenue for the Alberta government, to get back into balanced budgets, to start saving our royalty revenues, and to really start addressing some of the big ticket items like healthcare, which it continues to grow and grow and grow in the amount of resources it consumes and doesn't deliver service. So I tried to, as you can see, cover a pretty broad range of issues, but I came forward with a three-part plan that I think will address all of them.
I want to talk about those three parts going forward. The first you mentioned is the fundamental change is needed in how we manage our resource revenues. Can you talk a little bit about that and what you mean in that area?
Yeah, and this is an idea that was planted with me years ago when we got back into balanced budget, or at least when former Premier Ralph Klein set aside enough money to pay off the debt. Then we started thinking about how are we going to manage our revenues. And I think they almost came up with the right idea at the time, which was to look at what was a reasonable average for what our resource revenues were in a given year. I think at that time it was about 3.5 billion per year, and say, we will not spend more than 3.5 billion in operating expenses. And then they had a strategy for what they would do with the rest. Part of it was to put into a sustainability fund, and part was to use for capital. But they never really implemented it. And because what happened is we ended up with windfall revenues, and they got greedy. And so we ended up just seeing more and more of the revenues used for operational expenses. So if you look at what has happened in the most recent year, we only had $2 billion of resource revenue, $2 billion. So we're already weaned off of it. We've already gotten to a point where we know that that is the low water mark. And my view is we should not spend any more than that on operational spending in a given year. I think we're on the cusp of a potential boom in resource revenues. If you look at what is happening with oil prices, if you look at what has happened with our major players, if you look at some of the pipelines that are getting built, in addition, all the opportunity that we have on natural gas, since we're a natural gas basin, and LNG. So why would we allow our governments to blow this opportunity one more time the way they have in the past? Let's identify that we're going to save, we're going to put $2 billion in operational revenues, and then save the rest. Either put it into a capital fund, 50%, or 70, and 50% into the Heritage Savings Fund. You can put even more away in savings, which would be my preference. But the main thing that I'm worried about is over time, we're going to see interest rates go up. I think it's undeniable. When you have this much liquidity, this much funding into the market, it's going to impact inflation. The Bank of Canada at some point is going to have to respond with higher rates. And if all we have is debt that is going to be subject to those interest payments, that's going to eat away more and more at our ability to fund our programs. If we can build a large, call it a sovereign wealth fund, similar to what we've seen in Norway or in Alaska, and it's generating investment income, that will provide a portion of long-term revenues. But we've got to get started. We should have started it and continued it on when Peter Lougheed came up with the idea years ago, and we should have continued beyond just inflation proofing what Klein did. We now have to start reinvesting in that fund and growing it so that we can have that long-term stable source of revenue from investment income.
Yeah, the second part that you mentioned is $4 billion in new user fees. What kind of things are we talking about here?
Well, this is, I know that it's enticing for, there's been a lot in the commentariat, and even I floated the idea too, saying, hey, we need new revenues. What about a sales tax? And the blowback is immense. Albertans, I think, it's funny, some Canadians define themselves by our healthcare system, which we'll talk about in a minute, but I think Albertans define one of the things that make us different is we don't have a sales tax. We don't want a sales tax. If you put in a sales tax, it has to be put up to a public referendum. Based on the feedback I've seen, it wouldn't pass. And so we're in this real conundrum now where, because we've been so reliant on resource royalties, everybody wants lower taxes, but they also don't want to see any cuts to social programs, and in particular healthcare. And so one of the ideas that I've been toying with for a number of years, I almost ran on this in 2012 when we were going into the election, but we thought it would be too hard to explain. Thought people would have a knee-jerk reaction against the idea of having to shoulder more costs for their healthcare. And so, but heck, I'm not in politics anymore, so I can put forward these ideas and face the blowback, because we need to have some new sources of revenues. And so what I have proposed is that we look at establishing health spending accounts for all Albertans. And it shouldn't really be that controversial, because to my great surprise, when I was in public office, I found out that the provincial government provides a health spending account for all of their employees. So all of the Alberta Union of Provincial Employees, I think it's at different rates depending on different job categories. But if you were to seed a health spending account of $375, this is something that is familiar to a lot of people. A lot of people already have this through their company. If government was to provide $375, they could challenge employers to match that amount. They could challenge individuals to match that amount. And then pretty soon you've got a nice little pot of money that can help you pay for all the things that currently aren't covered by healthcare. So the chiropractic and eye exams and eyeglasses and braces and getting your cavities filled and physiotherapy, like the list goes on and on. But I think we need to go one step further than that. I think it was an error to remove the health premiums that we had years ago, because it depleted a vital source of revenue, and it also disconnected people from being a user of a vital service. So I think that we need to bring that back, but bring it back in a smarter way. Bring it back in the forms of a genuine insurance program where you would pay some kind of deductible, right? So you don't need any major surgery in a year. You don't pay any portion towards your cost. You do have a major surgery in your year, and then you pay a portion of the cost in a deductible, just like you would if you had a claim in your car insurance or claim in your house insurance. And you can set it up in a way that is also going to ensure that there's equity. So if you're a low income individual, under $75,000 per year, maybe you have no deductible. If you earn between $75,000 and $150,000, maybe you pay a $500 deductible. If you earn over $150,000, you pay a $1,000 deductible. This is not unfamiliar. We've seen health premiums before here. We've seen health premiums based on income in Ontario and in BC. I don't think it would violate the Canada Health Act, but importantly, it would connect people to the fact that healthcare is not free. And it would also, if you had to pay a portion of the cost associated with any major treatment, you'd be a lot more discerning and you'd be a lot more demanding about being able to get that treatment on time. And I think it would put a lot of pressure for reform on the health system. The other thing I'd say is I think that we need to change the conversation about what we pay for through our health spending accounts and what we pay for through catastrophic government insurance and that the government pays for directly. So I think we can all agree you need a knee replacement, you need heart surgery, you need cancer treatment. That falls into the catastrophic category. Most of us would be bankrupt if we got diagnosed with any of those illnesses and had to be treated. But a regular checkup to your doctor, does that really have to be something that is covered 100% by government, or should that be paid for out of your health spending account? And maybe you don't want to see a doctor this year. Maybe you need to see a nutritionist instead, or maybe you need to see a psychologist because we've suffered mentally because of the lockdown for the last 18 months. I think that if you create a system where all of those initial kinds of treatments are put on par, creates funding for the health spending plan, but it also is more comprehensive. It would allow for more services to be covered. for a wider range of services. And I firmly believe, if anyone thinks that, I firmly believe our nonprofit sector would step up as well. If we identified that there were shortfalls for certain low-income individuals, I bet there would be all kinds of charities working on raising money so that they could help to provide those additional funds. And it would be a mechanism to be able to make sure that everyone gets the vital services that they need. But we need something transformational. So this would be a way of bringing new dollars into healthcare, but also I think transformational in how healthcare is delivered.
Okay, and the final the point is spending efficiencies, and $4 billion in savings there by re-engineering how we deliver programs. Obviously, this is a topic that many people, especially the taxpayer, loves to talk about, is about government waste. What do you figure can happen there? Or
well, let me tell you how I structured this. I propose that we find cuts after we do those other two things, because I think that there's this idea among conservatives that, oh, well, just find your way to balanced budget with 100% cuts. And then on the other side, it's, well, just find your way to the balanced budget by just raising taxes. And I hate to be the spoiler, but we are now with a $12 billion structural shortfall. $12 billion. $12 billion is the entire amount of personal income tax revenue that the province generated last year. So you can't solve this problem just with taxes. It's also almost the entire budget for what we spend on education and post-secondary. So you can't just cut out massive amounts of funding from those departments without really impairing services. So it's got to be a mixture of all three. So we've talked about how you create a new source of revenue from investment income. You create new dollars coming into the system with user fees through a health spending account. And the last part is asking the public service to do its part. I love the entrepreneurial attitude in Alberta, and I think our private sector has always been fabulous at creating jobs and finding new opportunities. But we have an underperforming public service, and it's got to stop. We have to be analyzing our public service on a basis of how innovative are they? Are they doing things the same old way they always have? Or are they finding ways, just like we're seeing in the private sector, to use technology, to improve services, to find efficiencies? And I think they failed us, quite frankly, and they failed us in the biggest department of all, which is healthcare, which continues to eat up more and more resources and deliver worse and worse and worse results. So you've got to start there. And when I look at what they've done in education, where they've created a model of 4 different types of delivery in public education. You can have publicly funded schools and publicly delivered education, which is the traditional model. You can have charter schools, which are also publicly funded 100%, but they're delivered privately. You're not allowed to charge user fees or tuition. You can have private schools, which get a much smaller amount of government funding, but they can charge tuition. And you also have homeschooling. So if we take that same kind of model and apply it to healthcare, keep the public hospitals as they are, but get aggressive on allowing for charter hospitals, so that we need to find an initial pathway for that first charter hospital to get established. And then that can be transformative to the healthcare system. I mean, when I hear about some of the things that exist in other provinces, Quebec is a kind of a leader in privately delivered services, same as British Columbia. Why can't we do that too? Why can't we have a shoulder hernia clinic like they do have in Ontario that even former prime ministers have gone to? Why can't we have knee and hip replacement clinics like Cambie or False Creek like they have in British Columbia? Why can't we have something like a Mayo Clinic North, where rather than, if you are trying to find out what's wrong with you, you have to wait months and months and months and months between different specialists to get your appointments? The Mayo Clinic has a system where you go in and you get to see all 10 or 12 specialists in a single day, and they're able to diagnose you that day. I also know of people who have children with rare diseases. Why can't we create a charter hospital that treats rare diseases and then is able to attract patients from around the world, and then has enough patients that they can negotiate with pharmaceutical companies if a new treatment becomes available, rather than having to pay $1 million for a dose for a child? So none of this is going to happen in the current healthcare system. They've had their chance. We've given them since the 1980s to run everything and take care of business, and they failed. They failed because we do not have the innovation. We do not have even the ICU beds that we discovered during COVID. We do not have the same number of specialists. We do not do the same amount of surgeries. We do not have the same technology. And so if they failed with all the money that we've given them, we've got to try something different. And the only way to make the system be more responsive and innovative is to bring in an element of entrepreneurship. And that's why I think we've got to get going quickly on establishing these charter hospitals, and that will be transformative. And in doing so, I think we will find ways to reduce the burden on the public sector. We'll put the burden on them to follow what's happening in the private sector with the entrepreneurial approach to delivering innovations, and I think that's the way that we'll end up cutting the cost of government services. So I think that to me is the most exciting part. I would hope that public servants would recognize this as an exciting challenge. Like it must be a demoralizing environment, quite frankly, to be receiving as much money as the healthcare system does, and to see the level of underperformance and the level of waste. And so if we can challenge our public service, that we know that they know how to improve services, maybe you'll end up with those who are in the public service already deciding to start up a charter hospital because they can do it better and they can create a work environment that is preferable to what they have under Alberta Health Services. So I think that the solutions are there. We just need government to put the mechanisms in place in order to unlock it.
Okay, super. Well, thanks a lot, Danielle, for joining us today.
My pleasure. Thanks, Mario.
All right, that was Danielle Smith, who is the author of a new report released today called Alberta's Key Challenges and Opportunities, a report done for the School of Public Policy at the University of Calgary. This has been Business Insider with Mario Toneguzzi on YYC Business. Thanks for joining us today.